It is very important that you don't self-diagnose or diagnose somebody else. The clear and real diagnosis of ADHD really should be carried out by a psychiatrist, a physician, or a very well-trained clinical psychologist. There are clear criteria for what constitutes full-blown ADHD. However, many of us have constellations of symptoms that make us somewhat like somebody with ADHD. And if you're struggling with focus nowadays, as a lot of people are, pay attention to the symptomology. You may actually require professional treatment. You might not. Equally important is to remember that some of the terms that we cover, like impulse control and attention and concentration, are somewhat subjective and they can change over time. Sometimes we have a better level of attention than others. Maybe it depends on how we slept or other events going on in our life or something that we're entirely unaware of. The important thing to remember is that we can all improve our attentional capacity. We can all rewire the circuits that make heightened levels of focus more accessible to us. So right now, the current estimates are that about 1 in 10 children, and probably more, have ADHD. Now, fortunately, about half of those will resolve with proper treatment, but the other half typically don't. The other thing that we are seeing a lot nowadays is increased levels of ADHD in adults. And there's some question as to whether or not those adults had ADHD that went undetected during their childhood, or whether or not ADHD is now cropping up in adulthood due to the way that we are interacting with the world. For sake of today's discussion, attention, focus, and concentration are essentially the same thing. People with ADHD have trouble holding their attention. What is attention? Well, attention is perception. It's how we are perceiving the sensory world. So just a little bit of neurobiology 101. We are sensing things all the time. There's information coming into our nervous system all the time. For instance, right now, you're hearing sound waves. You are seeing things. You are sensing things against your skin, but you are only paying attention to some of those. And the ones that you're paying attention to are your perceptions. So if you hear my voice, you are perceiving my voice. You are not paying attention to your other senses at the moment. But impulse control is something separate, because impulse control requires pushing out or putting the blinders on to sensory events in our environment. It means lack of perception. Impulse control is about limiting our perception. People with ADHD have poor attention and they have high levels of impulsivity. They are easily distractible. But the way that shows up is very surprising. You might think that people with ADHD just simply can't attend to anything. They really can't focus. However, people with ADHD can have a hyperfocus, an incredible ability to focus on things that they really enjoy or are intrigued by. Typically, we think of somebody with ADHD as being really wild and hyperactive or having no ability whatsoever to sit still and attend. And while that phenotype, as we call it, that contour of behavior and cognition can exist, many people, if not all people with ADHD, if you give them something they really love, like if the child loves video games, or if a child loves to draw, or if an adult loves a particular type of movie or a person very much, they will obtain laser focus without any effort. So that tells us that people with ADHD have the capacity to attend, but they can't engage that attention for things that they don't really, really want to do.